Hi guys, so today I'm going to go ahead and talk about my 3 favorite technologies that I use here in the office. And I use these to do a comprehensive exam on every single patient that comes into the office. So my 3 favorite are the digital X-ray machine, the Ortho Scanner, and the intraoral camera. So my first piece of technology that I really like, and it's the most common throughout most offices, is the digital X-ray machine. So I use these X-rays on every patient, mainly to find any interproximal decay or to see if there's any recurrent decay under any existing restorations. It also helps me to reveal any signs of perio disease, any oral abnormalities, any infections. Okay, and what I also love about this technology is that it's instant, so I can show the patient on the monitor right away, and I can also edit the image in order to kind of explain and diagnose and also educate the patient of what's going on in their mouth. So my second favorite piece of technology is my Ortho Scanner. I love doing a lot of ortho and Invisalign in the office, so this is the technology that I really enjoy using. What it does, it offers me a 3D scan of the patient's entire dentition, their bite, any kind of wear, abfractions, and at this point, when I show patients this product and the scan, this is when they actually start bringing up questions and asking questions and what they see on the screen or why their bite looks like that. And it really helps me educate the patient when they're asking me questions about what they're actually seeing in their mouth. Patients have difficulty noticing the small changes that are happening with their teeth over time, whether it be any kind of movement, whether it be any kind of wear happening or any kind of abfractions happening. So this program actually has a time-lapse device that actually shows the patient what's happening at every scan, how much movement's happening, how much wear is happening, how much abfraction or anything like that, how much is happening over time. So I scan the patient once a year so I can show them that difference. And patients say, oh, I don't grind, I don't clench, I'm not wearing down my teeth. So when I actually can show that year 1, you have more tooth structure than you had year 2, and I'm able to show them that they are actually grinding or wearing down their teeth and they do need some kind of occlusal guard. Alrighty, so my absolute favorite part about this Ortho Scanner is the outcome Invisalign simulator. So basically give them a digital representation of what the final product may look like. This is how I get a lot of case acceptance and patients starting Invisalign in my office. And it's the most important tool I have. Everybody wants to see what the final product is going to look like if they can. And so when they see that their crowded dentition is finally going to be aligned, this is when you get a lot of patients starting Invisalign. Another good tool with this for Invisalign is that it has a progress tracking system. So as they're wearing the trays, every time they come in every 6 to 8 weeks, whatever it may be, we go ahead and rescan them and make sure that the teeth are tracking with the trays. And if they're not tracking, then we have to either make some changes in terms of what tray they're wearing or for how long. I also use this Ortho Scanner to take digital impressions. So I'm basically impression material free for the most part. So I'm taking impressions of crowns, implants, bridges, any kind of restoration, and what happens is just scan it, send it straight to the lab, and the lab starts fabricating the case. So it's very easy. Patients love it because there's non-impression material everywhere. So it's a very good tool. So I love the Ortho Scanner, and I definitely think that every office should have one.
Hey everybody, thanks for tuning in today. Thank you, Dr. Shaun, for talking about some of your favorite technologies. Listen, stay tuned for tomorrow's episode because it's going to be a lot of fun. It has to do with that Living Your Burst Life contest we had back in the spring. That's coming up tomorrow. And we wanted to know from our ambassador group, what are their favorite technologies? So here's what they had to say.
Hi guys, just sharing my favorite piece of technology in my operatory, and it is the AFlex Assist Arm. What this is my third arm when I am in the middle of doing sealants or scaling rope planing and you need one hand to hold suction and you still need one hand to retract and you need one hand to use your Cavitron or to place sealants. This is it. So what it is, it's an arm that attaches to the back of any chair. There's a suction cup that holds onto any type of surface, and if it's not a surface that it will hold onto, there are attachments so that it will. You just take your suction in the candy cane shape, you place it into this handy dandy holder here, just like so, and then you're able to position it into the position where you can pop it in the corner of the cheek in a comfortable position for the patient, and it will stay. And you can use your other two hands for whatever procedures you're working on. So it's like having an assistant in the room without paying another person. But it's called the AFlex Assist Arm.
I'm Alice Wilson, and I'm a Burst Ambassador. I'm going to show you the dental rat, which I've previously called the perio rat. So here we go. This little gizmo here is a foot pad, and while you're perio charting, you can hit 1, 2, 3, or 4. You can hold the 1 to make it a 5, hold for 6, and so on. This is your mouse, and you can use your toe to toggle this around and move your mouse on the screen. You can left click with your heel. I usually leave the cursor on the bleeding point, so as I go along I can just left click for that. This works very well for me. It's a plug and play. You just put the USB into your computer. There's my little dental rat right there, and they have it set up so that it can do all software. Works very quickly, very easily, and I love it. Thank you so much. Have a great day.
So the coolest thing about my office is that we have a microscope. I've actually used it with root planing patients to where if there's flappy tissue, I can look subgingival to see if there's any residual calculus. So here's the microscope. So it's attached to the wall, to the ceiling, and we pull it over to the chair, and you look through the lens, and everything is wrapped up in this plastic for infection control, but it does not occlude the lens on the bottom. Pretty cool.
My favorite piece of equipment at the office is the BioLace laser, because we use it to decrease the amount of bacteria that people have in their mouths, and it's super helpful during scaling and root planning to eliminate bacteria as well.